Hey, I'm Dr. Gregg with Align Wellness Center, and I wanted to spend a few minutes with you today showing you what an adjustment may be like if you're experiencing dizziness and or have neck pain. Today I've got Carol with us. Carol, you want to say hi?
Hi.
Carol's been a wonderful patient of ours and has been in to help work on her neck stiffness, but she's also had a lot of problems with dizziness. What kinds of things have you done for your dizziness in the past?
Actually, I've come to see you.
Have you done anything else?
I've done exercises that you've told me to do.
Have you done vestibular therapy too? I think you mentioned that to me.
Yes.
Yeah, and have you done physical therapy for it too?
And physical therapy.
Okay.
They all helped a lot.
Okay. Well, we're going to work on doing an adjustment for her entire spine to wind up decompressing the nerves that are irritated and see if we can wind up helping her. Carol, why don't you go ahead and lay down on your back? So when we wind up looking at someone to understand about neck pain or dizziness, one of the main areas we do focus on is the neck and the cervical spine. You know, there are four main components that contribute to balance dizziness issues. The first one that we typically think of wind up being the vestibular canals in the ear. Now, those can wind up affecting us tremendously, and those are probably the largest component of the dizziness factor. The other three typically get ignored, and that's what we really look to focus on with our patients here. So the joint receptors in the cervical spine and neck wind up having massive feedback and information that go up to your brain and talk with the balance centers. So when there's a disturbance or change in your neck, there's a high likelihood, if it's been there for a long time, that your neck can be a component of it and it can turn into dizziness. I'm going to have you give yourself a hug. We're going to turn towards me and roll back. Good. And we'll do that again. Go ahead and flip over for me. The second one that people typically don't think about wind up having to do with the proprioceptors throughout the body. So these are nerve fibers that wind up telling us about pain, position, and placement. Now that's pretty tender there, Carol, is that correct?
Yeah.
So for Carol, we use some really unique tools to help with our adjustments. So we're going to use our arthrostim to adjust in her mid-back area here. So these proprioceptors feed that balance part of her brain and are misfiring and misconnecting. A little easier, Carol? Great. Awesome. The last one that I talked about that relate to balance and is typically overlooked or ignored have to do with the temporomandibular joint or the jaw. So after we've adjusted her spine, we're going to actually look at her jaw and see if there are any irregularities going on. But we're going to finish adjusting and looking to change her spine. All right, Carol, would you sit up for me? Okay, so we're next going to go on and do an evaluation. We're going to look at your jaw, okay? I'm going to have you hold your arm up, bite down hard, open up wide, open up wider, jaw to the left. Okay, so the jaw to the left, Carol, is going to look like this.
Oh, that way, okay.
There you go. And jaw to your right. Good job. So I like how those muscles are connecting, but we're going to still look to do a gentle adjustment with you on your jaw. So we're going to use our arthrostim here. And that was our adjustment for Carol today. Carol, how was your adjustment today?
It was great.
Awesome.
I feel more relaxed.
Then I love it. And over the last couple of weeks that we've worked together, what have you noticed about your neck pain?
It has diminished.
Super. And what about the dizziness?
Dizziness, lately I don't have any.
So it's gone.
It's gone. This last week.
That's pretty awesome. So you've gone a week without dizziness. And before we started this group of care, how often were you having it?
All the time.
All the time. Super. What would you tell to someone who's experiencing dizziness?
Go see you.
Go see me. Thank you so much. So if you or someone you know has been experiencing dizziness, you're having a hard time with dizziness, let's have them come in and get checked to find out what's going on. If you know someone with dizziness, please share with them this video. Also, if you liked it, give it a thumbs up. Once again, I'm Dr. Gregg with Align Wellness Center, and thank you for letting me be a part of your